Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is what you need to know about acute and chronic back pain. First, some facts. Over 90% of Americans will experience back pain at some point in life. Regardless of whether or not treatment is sought, 90% of back pain gets better within 6 to 12 weeks. An unfortunate few will end up with chronic back pain. So some definitions: acute back pain 6 weeks or less, subacute 6 to 12 weeks, and chronic means over 3 months. Back pain is the second most common reason for doctor visits, only second to the common cold. Half of all working Americans admit to having back pain every year. It's the most common cause of worldwide disability. When you add up the direct and indirect costs of back pain in the U.S. each year, it's over $100 billion. So the causes, let's go through those. For the soft tissue causes of back and leg pain, far and away the most common is a back sprain or a strain. And for instance, you can see in the picture here, a gentleman's lifting boxes and has pain in the back. Oftentimes that's a muscle strain or a ligament sprain. And usually, by and large, those go away within a few days, but that's the most common cause. Disc degeneration. Here's what a normal disc looks like in a cartoon mode. You have two areas. The inner jelly part is the nucleus pulposus. The outer harder part is the annulus fibrosus. So the analogy is a jelly donut with the harder outer part and a jelly on the inside. The only nerve endings, there's no nerve endings here, so there's no pain. But the outer part, the annulus, does have some nerve endings. Here's a cartoon of degenerative disc disease. So you see a healthy looking disc here, and then you start to see a degenerative bulging disc. You see the bulging? It's like almost a tire that's getting flat. And then here it's so degenerative that you can't even really see it, between the vertebrae. For a bulging disc or a disc with a tear in it or a disc herniation, here's a couple examples of those. A normal disc would be an elliptical shape. This one has a herniation coming backwards that's pinching a nerve root. That inflames it and that causes sciatica. Okay? If that happens up in the neck, it's called radiculopathy, but it's the same concept. This one is, you see the annulus here, that outer harder part. It has a tear in it due to degeneration. Okay? And that can be painful because, as mentioned, there are nerve endings in this outer part. Sciatica. The sciatic nerve is composed of 3 nerve roots. 1, 2, 3. They come together, form the sciatic nerve, and they go down the leg. So depending on which nerve root is being pinched, that depends on where the sciatica pain and numbness occurs. Okay, so we saw this before. You have a disc bulge, and the bulge may be large enough to pinch on a nerve root, and that can cause sciatic pain coming down the leg. For the bony causes of back pain, by and large, the most common cause is arthritis. Okay, you start to get disc degeneration, which can lead to some bone spurring that can pinch on nerves or cause back pain. These joints, the facet joints, those can get arthritic. They have cartilage just like any other joint in the body, and that can cause significant back pain. Sacroiliac joint pain causes up to 25% of back pain. It's amazing. There's a left and a right, and here you see it's kind of an irregular, jagged joint, but it's very prone to arthritis as we age. Scoliosis in adults can be a considerable source of back pain. Interestingly enough, scoliosis in kids usually doesn't cause back pain, but in adults it's often due to arthritis, asymmetric arthritis, so you end up getting a curve, and that can be cause a lot of back pain. Spondylolisthesis, very common as a person ages. Listhesis means slippage, so what's happening is one vertebrae is slipping on one below. Here you see L5 on top of the sacrum. And what can happen is this can lead to arthritis and also pull traction on a nerve root, so you can get back pain and leg pain because you're pulling on a nerve root when you can cause sciatica. Spondylolysis, you see this fracture here? It's actually a stress fracture in the spine, and it's called spondylolysis, and that can cause pain. It's usually in younger individuals who are participating in activities such as gymnastics, football, these repetitive activities that cause stress in the back. Okay. Spinal stenosis is when you have bony or soft tissue overgrowth due to arthritis, and as you can see here, this is a vertebrae. This is the spinal cord, and you have a nerve root trying to get out, but the overgrowth here is pinching it, okay? And that's called spinal stenosis, and that usually leads to buttock and leg pain, and can be a big problem as a person ages. For the uncommon causes of back pain, you have infection, fracture, and tumor, okay? This is a fractured vertebral body. I put uncommon here, but it's really actually fairly common to get a compression fracture due to osteoporosis. But when you compare it to the other causes of back pain, it's not nearly as common. The top pain management clinics in Colorado are Colorado Pain. They have multiple locations in the Denver metro area. Over 50 insurances are accepted by the board certified pain management doctors. The number to call for treatment is 720-306-9575, and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green, CEO of the Colorado Pain Network. Your pain stops here.